Good afternoon, everyone. My name is Kim Stevenson, and I'm Director of Workforce and Clinical Affairs at the Massachusetts Health and Hospital Association. I want to welcome you to today's webinar, Proven Solutions for Finding Healthcare Talent, MassHire Workforce Boards, Career Centers, and the Workforce Competitive Trust Fund. A few logistics before we start. If you have questions during the webinar, please enter them into the chat feature as we are in listen-only mode. The questions will come directly to us, and we will do our best to address as many of them as we can at the end of the presentation. I also want to take a moment now to thank MHA's 2025 annual sponsors and strategic partners for their support in underwriting today's webinar. This is just one of many events we offer throughout the year to connect our members with leading experts to help address timely issues. I'm pleased to introduce our speakers today. We have Ken Brown, Assistant Secretary, Employer Engagement and Employment Outcomes at the Executive Office of Labor and Workforce Development, Matt Hartman, Assistant Secretary for Workforce Innovation at the Executive Office of Labor and Workforce Development, Tommy Heverin, Senior Program Manager for Workforce Competitive Trust Fund at the Commonwealth Corporation, Tom Hooper, Vice President of Sector Pathways for the Commonwealth Corporation, Jennifer Murphy, Director of Workforce Competitive Trust Fund at the Commonwealth Corporation, Jason Pacheco, Director of Workforce Planning and Analytics at Bay State Health, and finally, Joanne Pokaski, Assistant Vice President of Workforce Planning and Development at Beth Israel Lahey Health. Thank you so much for being here today as we're looking forward to this discussion. I will hand it over to our speakers now to get it started. Thank you.
Thanks so much, Kim. Good afternoon, everyone. My name is Tom Hooper, and I'm the Vice President of Sector Pathways with the Commonwealth Corporation. We're really excited about today's webinar, and a big thanks to MHA for this just terrific opportunity, and to you all for joining us today. The focus of our webinar is introducing you to some of the state's key workforce development programs and resources that can help you hire, train, retain, and advance your employees and in their careers. Healthcare is such an important sector in the state with a wide range of pressing workforce needs, and that range across a number of occupations. The Executive Office of Labor and Workforce Development and the organization I work for, Commonwealth Corporation, have established programs which can help you address those workforce needs. And today we'll review some specific programs and other types of resources and ways that you can access them. I'm first going to provide you with just a brief overview of today's webinar. During the first portion of the webinar, you'll hear about some of the Executive Office of Labor and Workforce Development's programs and resources from Ken and Matt, and then Joanne will discuss her experience with those programs. During the second half of our presentation, Jenny, Tommy, and I will discuss a program managed by Commonwealth Corporation, which can help you hire and train new workers and enhance the skills of your incumbent workers. And Jason will share his involvement with that program. We want to ensure that we're answering your questions, so please share them in the chat throughout the session, and we'll make sure we pause periodically to address them. Before we get started, we wanted to get a quick sense of your familiarity and previous work with the MassHire Workforce System and Commonwealth Corporation programs. So given that, we'll post a quick poll question, and please let us know your thoughts, and Nick will bring that up now. So the question is, and you can see it on your screen, who is engaged with MassHire and Commonwealth Corporation for healthcare workforce training or talent acquisition? And if you could just answer yes or no, that would be great. And we'll take a minute for this, about 30 seconds, and then we'll post the results. Okay, excellent. Oh, well, that's great. So many of you have some experience already with either MassHire or Commonwealth Corporation's healthcare programs, which is excellent. We're excited to share some new information with you all today. And for those that haven't had experience, we're excited to introduce you to the MassHire Workforce System and our programs as well. Excellent. So that's a quick overview of the webinar today. And now I'm going to hand off to Ken to start to talk about the MassHire Workforce System. Ken, the virtual mic is yours.
Great. Well, thank you, Tom. First of all, I really want to thank MHA well, I guess it's now MHHA, for hosting us today. Had the opportunity really to work with Steve, Valerie, and Kim over the last year and a half to try to meet some of your workforce needs. And my hope today is that we can give you really a general overview of some of our offerings, also create points of contact going forward. Also, just looking at our agenda, telling you about sort of our revamped customer service model, our offerings, our workforce development footprint, and that is growing. Some of the initiatives and projects that we're working on in 2025 to develop talent for you to meet your workforce needs. And we know in this sector, and talking with Steve and Valerie and Joanne and many of you out there in the field, that your hiring needs are significant, and they really reach a broad geography and a broad number of job descriptions. And of course, it's not only the here and now, but also looking at jobs for the future. And I've had a chance to talk with some of you about what those jobs might be and how we can help you stand those up. And again, because we have a full agenda, again, we're just going to kind of touch upon a number of things. And my hope is in that the Q&A, we can dig a bit deeper, but also my hope is that we can make connections that go beyond this webinar, and that you'll reach out to both myself and my colleague, Matt Hartman. I'm happy to be joined by Matt. Matt joined Labor and Workforce Development about, 8 or so months ago, and we will be sort of tag team in this presentation today. I'm going to talk about our offerings, and Matt will talk a bit about our footprint. But before we get into our offerings, I want to talk a little bit about our customer service model, because it really is an important, I think, outgrowth of what we're trying to do at Labor and Workforce Development. And that is really listen to you in the field to create solutions that really meet your hiring needs, that meet them from a time horizon standpoint, but also from a skills standpoint, also from an upskilling standpoint. So I think it's important to know, I like to say, this isn't your grandfather's or grandmother's MassHire Career Center. We're really trying to meet you where you are with respect to your needs. Nick, we can go to the next slide. And again, this is just a reiteration. We won't go through each slide, but again, I think it's important to raise this slide because I really want to solicit, if you will, feedback from you on your needs and how we can meet those needs. Again, I like to say this isn't a linear process. Every one of you has sometimes similar hiring needs, but sometimes your time horizons are different. Your focus areas of hiring needs may be different. So we want to engage directly with you and not take a cookie cutter approach. Nick, next slide. This slide really just breaks down some of the offerings, if you will, the buckets, if you will. Some of the things, I know that if we have 81% of you have dealt with our career centers or ComCore, that you're going to be familiar with what we do. So I want to speak to growing that 81% to 100%. We have 19% of folks have not dealt with our career centers or ComCore. So we're going to speak to both those that have dealt with us and those that are yet to. A couple of things that we really focus on. I like to say that Labor and Workforce Development should be about talent, and there's a whole bunch of prongs that come off of talent. But our focus, I think, today and going forward is going to be on talent acquisition, training, and ComCore is going to play a significant role in that discussion. Some hiring incentives that we have. Talk a little bit about our rapid response team that my hope is that you will not need, but if you do need, they're at the ready. And also, one of the big things that's happening in the Healy-Driscoll administration is a true coordination across our secretariats to meet your hiring needs. I did a call with Steve and other healthcare sector leaders a few months back, and we had a whole host of secretariats on the call in addition to Labor and Workforce Development. And one of the solutions that I want to offer you all is helping you make points of entry, points of contact across the administration beyond just health and human services. And that may mean economic development, It could mean the Department of Education. And that's just something that that really is the hallmark of this administration. It's, again, working across secretariats to meet your hiring needs. We'll talk more about that in depth as we go along. Nick, next slide, please. I love logos. I think logos in some ways can sort of say it all. When it comes to talent, we want to focus, I think, on three buckets: attracting, retaining, and developing talent. And these are some of the entities that Matt and I work directly with. Obviously, our MassHire Career Centers. We have a digital platform called Mass Talent, which has a section entirely dedicated to healthcare. That's really look at that as a state sponsored version of Indeed, to the extent you need an analogy. Again, Commonwealth Corp is just a great partner. We are all under the Labor and Workforce Development umbrella, and they really, I think, are going to be great partners with you going forward in terms of how do you train existing talent, how do you bring in new talent, how do you upskill existing talent. And also, and I know this predated this session, I believe you did a session with the Division of Apprenticeship Standards. But again, this is kind of our talent portfolio. How do we bring these folks into the fold, into your HR system? How do we upskill existing workers? These are just some of the really the agencies and programs that we have to help you with talent acquisition, as I know that's an important part of our discussion today. Nick, next slide, please. Training. Again, none of these portfolio offerings sit in a silo. They're all very related. Training, again, it's great to have ComCore on this call. You're going to hear about their terrific programs, and one program in particular, Division of Apprenticeship Standards, again, and our career centers. These are really the pillars, if you will, of our talent acquisition, our training offerings. Nick, next slide. This is a bit of a, I don't want to say a work in progress, but this changes over time to some extent. When we talk about our offerings and you talk about hiring, it's important, obviously, to be strategic about meeting your hiring needs, but also collecting resources that may benefit and grow your workforce. We do have a number of incentives which we can talk more in depth about, hopefully in the Q&A. One is the Registered Apprenticeship Tax Credit, which for those who participated in the DAS seminar, I'm sure you talked a bit about that. We also have a Work Opportunity Tax Credit, which is essentially a federal tax credit. And I've just raised a couple of cohorts here that may be of interest to you. Massability, which is our agency which helps and promotes those with certain disabilities. And these are really a terrific cohort of folks, and I'm happy to talk more about that. But those are folks that may have any number of disabilities, and we try to place them in jobs, and we provide extensive support through our Massability agency to help you integrate these employees into your workforce. And also, should you qualify, there's a tax credit. And also veterans. Again, we are often promoting our veterans community for all the right reasons. And in the healthcare space, so many of these folks come with different disciplines that we know can be repurposed in some cases to work in the healthcare sector. And also there's a tax credit available in many instances to when you hire veterans. Whoops, something is covering my slide here. And then in terms of hiring incentives, it's not necessarily a hiring incentive as much as it's connecting you to our Executive Office of Economic Development to see if there may be some programs that may focus more on the economic development incentive, capital improvements, if you will. But I put this on because I have been working very, very closely with what is known as the business front door to really present the whole host of offerings to businesses, whether they're looking for economic development help or workforce help, because I'd like to believe if you can make certain capital improvements, and I know it's not this simple, but I'm going to simplify it for us. You may you may free up some capital to perhaps reinvest in training of certain employees. And my hope is that through this call, I can make introductions to folks at Economic Development and the business front door for you, if you so like. Next slide. We're going to go a little bit faster here, as I know we're pressed on time. This is a bit of the business front door. Again, I said this earlier. It's helping you coordinate outreach across state government. It could be everything from Health and Human Services to economic development, but our focus here today for Matt and myself is more focusing on the economic development piece. And also Matt will talk a little bit about some of the things we're working on this year and beyond around education and ESOL. And we'd like to connect you to those programs as well, because we know it's not simply about training. In many cases, it may be about removing barriers to employment. And we'll talk a little bit about that. Next slide. This is something I hope that you don't have to engage, but I felt compelled, given the economic climate, to raise this with you. We have a rapid response team that sits within Labor and Workforce Development, and I'm not going to go through this slide in full for purposes of time, but just know that in the event that you do need to engage in some layoffs of folks, that we have a rapid response team that can meet with you or these employees in advance of a layoff or after a layoff to help them apply for unemployment benefits, to connect them to our career centers, to connect them in real time to our career counseling services and job fairs, et cetera, that they may be needing post layoff. We also have, and again, I won't go into great detail unless we get to it in the Q&A. We also have a work share program, which is really administered through DUA, Department of Unemployment Assistance, to mitigate the number of layoffs. There's a match, if you will, to retain a certain percentage of employees, and we can get into how you may benefit from that should you want to discuss mitigating potential layoffs. And I just felt compelled to raise our rapid response team because, as you can imagine, we have been engaging our rapid response team with both federal workers as of late and also furloughed workers. So this is very much on my mind, and it's very much engaged in full at the moment through Labor and Workforce Development. I hope the next slide is going to be handed off to Matt Hartman. And Matt's going to talk a little bit about the talent front door as well as our workforce footprint. And I apologize for sounding like an auctioneer, but Tom Hooper always tries to keep me on time. So I'm going to hand it off to Matt Hartman. Matt, over to you. And Nick, thank you.
Thank you, Ken, and thank you for MHHA for hosting this. I think one of the key aspects that I want folks to walk away with today is to think about how to get to know your workforce board. That's really the hub of our system. The MassHire Workforce Boards are where we convene locally to serve employers and talent. It is a labor exchange that takes place at these MassHire centers. And really, that's the space where you want to go when you've got these labor needs that you're experiencing. These boards are set up based upon federal law and state law. They're both federally and state funded and privately funded as well. That's one of the real unique aspects about how these programs work, is that they're able to access a lot of different places to serve the needs of employers and job seekers. There's over 100,000 job seekers a year that walk in the front door of these workforce centers across the state. And that's a really significant point of access for employers to engage with talent and to make that connection. And that's what these job centers are really focused on every single day. So I'd really like folks to walk away today with a real understanding of how to get to know your career centers in your areas and where they are structured across the Commonwealth. So the next slide, if you want to go to that one, shows you how our system is structured. There's 16 workforce boards across the state. They're varying size, largely, a lot of them are based upon counties and other geographic areas that exist in the Commonwealth. And they're there to serve those regions' needs directly. The workforce boards themselves are made up of employer majority on the membership of the board. That's a statutory requirement, but it really brings a strong employer voice to the needs of what they're experiencing in each of these 16 areas. It provides an opportunity to have that direct dialogue with employers to make sure they're providing the services and the trainings that are needed for those activities in those regions that employers are speaking to the need of. So, you'll probably recognize, if you start to look at the workforce boards in your area, you'll probably start to recognize some of the names on these boards as they're employers that are right near you in your areas. And that's the real local approach to how this system works, is it provides local opportunity to respond to local needs, but it provides that doorway into the rest of the state system that Ken was talking about. It's a great space where we can have a lot of connection to different programs, not just the programs that MassHire offers directly, but it provides that doorway into for both talent and for employers to make that connection to all of these statewide services. So this map is available online. We're happy to connect people directly if people have questions of where they fall. I'm really glad to see that earlier we had at least some people that have not interacted with their workforce boards and MassHire before, or Concor. And so if folks still have direct questions, we're happy to kind of connect you with each of these boards directly throughout when you have a question about it. And I think we want to just make sure that you're walking away with that connection, especially as a new employer possibly looking towards workforce needs. So we can go on to the next slide. So as I mentioned, there's federal and state programs that feed into this system. This is outlining some of the direct services that are offered by the MassHire services through the federal side of things. It's called the Workforce Innovation and Opportunity Act. These are just the programs that exist within that. This is the primary structure that exists that underlies the workforce system in Massachusetts and across the country, really. So these are the different program buckets that exist. Call out a couple of them. The Wagner-Pizer program is really a general career services program that's offered to job seekers. It's a way of anybody walking in the front door who has a need to get back into the workforce, or to upskill in the workforce, or to learn how to do their resume better. That's where funding comes from that. Adult and youth are targeted towards certain populations of adult and youth. So we have folks coming in with certain work barriers that they need to overcome, and the adult and youth programs typically are where those individuals would end up, and we assist them getting into the workforce, getting to the right skills that they might need to overcome, or particularly, sometimes this is where ESOL starts to play a role when people have an ESOL barrier. And also dislocated worker is people who've been dislocated from the workforce for some time. A lot of this is folks who are unemployed because of layoff, but it's also people that may have taken some time to do other things outside of the workforce that are now coming back into the workforce. And so it's a program that's directed with that. We also have on-the-job training program, which is a funded program that helps employers start to bring people into their employment, and other grant-funded training programs. And I think this is a great space to think about it as a hub, is that there's a lot of different grant training programs that are not necessarily coming directly from the MassHire system itself, but MassHire connects you to those programs. As Ken is talking about, in particular, Concor has a whole host of them, which they will get into in their portion of the program. But this is the hub where you can go into and start to connect with those programs through the MassHire system. We can go on to the next slide. So here's another kind of listing of different programs and how they start to connect you. We can think about the MassHire system as that hub. You can come in with a need that you need to have a certain number of workers with a certain kind of training. MassHire will work with you. These boards will work with you to figure out what is the combination of services and programs that we can put together to make this a successful relationship, a successful labor exchange. You think about, I have a need for a rad tech at a hospital, but I know that in my area, there's a lot of English skills barriers. How do we create a program that combines ESOL with maybe an apprenticeship? These are the types of questions you can start to ask of your MassHire workforce boards and start to get some answers and start to pull together different types of programs to make the combination work. So we work with the Department of Ed, with ESOL, which recently, through the legislature and the governor, we have a significant funding resource available now for ESOL. We also work, of course, with the MassAbility, youth employment programs. Community colleges are a significant partner, the Division of Apprenticeship Standards. Healthcare hubs is in each of the regions, and that's another significant resource that you can access, as well as, kind of what Ken got into about the cross-secretariat work that we do of connecting beyond just the Executive Office of Labor and Workforce. So we can go on from there. And so I think this is moving into our conclusion area. I think what we just want to cover is thinking about MassHire as a real workforce hub, a place where you can get questions answered, a way that you can combine resources to address your regional and local needs, but also be able to access more statewide incentives and programs. I think, some great examples that we've seen are where, we visited a program in Holyoke where they had a CNA program with a directly embedded ESOL program. That wouldn't have been possible without that kind of partnership programming that exists at the MassHire as a hub. So I think that's the message we want to walk away with today. Is there's lots of opportunities, lots of partnerships that can exist. MassHire can be that hub. We are here to help you engage with that. I think Joanne's going to follow up with a lot more stories about the experience that she's had. She's had quite a long range of experience. But that is the main takeaways that we want to walk away with today. The next two slides are just kind of how to access us and some resources so we can kind of flip through them. But that's kind of the end of our discussion at this point, giving you some basic information about what we are and what we can offer. If you want to just click through the next slides, I think that'll be pretty much the conclusion, unless Ken has more to say about his side of things.
No, thanks, Matt. I think we're ready to hand it over to Joanne.
Great. Thank you.
If I could interrupt real quick before you start, Joanne, there's one question in the chat that might be relevant for you, Matt, and Ken. It's from Ona Harrington. Is the support for layoffs and workforce reductions for any level of the organization or just for certain levels of an organization? I think talking back to the rapid response.
All levels of the organization.
Thank you.
Okay, I'm going to kick off. Hi, I'm Joanne Pokaski. I'm the Assistant Vice President of Workforce Planning and Development for the Beth Israel Lahey Health System. Next slide. I like to think of workforce development, and what we try to do is bring people from our communities into our jobs and careers, and then help everybody in our organization continue to move up to the top of their license and really build a career with us. Next slide. About 21 years ago, I started a workforce development program at BIDMC, but before that, I ran a one-stop career center in Roxbury in Boston. And so I understand what a one-stop career center does, and it's such a great resource. So my team really partners up with one-stop career centers for a few things. So a one-stop career center is kind of like your college career center that you go to and they help you find a job, but anybody can go to this career center, right? And they are full of active job seekers who are looking for their next job. So it's a really rich environment. So what we like to do at BILH, we offer a lot of paid trainings to BILH jobs. We have a paid training to be a medical assistant. We have a paid training to be a nursing assistant. We have a paid training to become a pharmacy tech and a paid training to become an endoscopy tech, as well as a training for nurses who have an associate degree to get their bachelor's degree and work with us as a nurse at the same time. So we often will push out that information to our local career centers to make sure that active job seekers are seeing these opportunities and taking advantage of those. We also push out information on critical vacancies that we have. So if we need lab techs in Plymouth, we will push out that information to the local career center in that area to make sure that they're aware that we're really looking for these folks with that sort of qualification. And then the last thing I want to mention is we like to build relationships with career centers for warm referrals to open roles. So if you are a job seeker and you apply to a big hospital like ours, you fill out an online application and you send it in and you get, oh, thank you for applying. And then maybe a few months later you get, oh, we closed that position. And that can feel very cold, right? But we want people in our communities to feel more of a connection to our jobs. And so we work with one-stop career centers for a bit more warm of a referral. So if you have John Smith who lives in Boston and he's applied for a job as an OR tech at the Baptist, the one-stop career center will reach out to folks on my team and say, hey, John Smith applied for this job. He hasn't heard anything. Can you check on his candidacy? So we'll look and make sure that John Smith has applied to a job that he is appropriate to apply for. We'll make sure, if he is an appropriate candidate for the job, that the talent acquisition person kind of sees that resume and thinks about it. And then if there's any feedback about his candidacy, we can give that back to the One Stop Career Center. So again, it's not kind of shooting your resume off into the dark and never hearing again. It's more of a feedback process. And that helps One Stop Career Centers get better at sending us the right candidates. It also helps the employee, it helps the candidate understand a little bit more about how this process works so they can make good choices as well. So we have that opportunity not only for One Stop Career Center staff, but staff at a lot of training organizations to connect with our folks and have that conversation around, hey, tell me more about Jane Smith and if she's likely to get a job as this, or give me some advice on what jobs Mary Jones should be applying for. Next slide. So if you look at the Beth Israel Lahey Health System, this is our geography. It's really eastern Massachusetts. So we go as far north as Exeter, New Hampshire. But in Massachusetts, we have Anna Jake's Hospital up in Gloucester. And then we go as far south as Plymouth Hospital, BID Plymouth. So this is our footprint. Next slide. And we try to match that up with, this slide might look familiar to you. This is the slide that Matt showed you. But in that red circle is really the area we're trying to focus on. Who are the people who live near our institutions, and how do we connect to them and make sure they know about the career opportunities? So if we're focused on helping to fill jobs at Anna Jake's, we're talking to the Merrimack Valley WIB. And if we're focused on people at Plymouth, we're talking to the South Shore WIB. Next slide. So a second way that we do a lot of work with the state is through Workforce Competitiveness Trust Fund, or Donnelly grants. So we've gotten 2 Donnelly grants. So one we got many years ago at BIDMC. It was a Boston Teaching Hospital's Med Lab Tech program. And so back then we partnered with New England Baptist and Boston Children's Hospital. This is BIDMC. And we built a new associate degree program to train up our employees to become med lab techs in the hospital, and we graduated 15 people. And then recently, we just completed a primary care medical assistant program. So we have 90 primary care sites in Eastern Massachusetts, and we worked with the local workforce boards to support our application and also to push out information about our program as it was happening. Next slide. So again, there's that oval. Think about 90 different dots within that oval. That's our primary care sites for BILH. Next slide. So the program structure for the medical assistant program was a paid program with 8 weeks of classroom education. And starting at week 5, folks did hands-on practice at primary care practices. When they finished the program, and if they were successful, they moved into a clinical assistant primary care position. At 6 months, they were promoted to medical assistants and got a salary increase. And at 12 months, they were eligible to sit for the certification exam. Next slide. So we consider this a successful program. We enrolled 72 applicants. We had 57 people complete training. 54 people moved into jobs and stayed at least 30 days. And when we conceived this program, we thought people would get paid $17 an hour, but we actually started them at $18, $19 an hour. And at 6 months, we were able to increase their pay to $21 an hour as medical assistants. Next slide. And then, so, I just talked about 2 grants where BILH was the lead, but we've also been a participant in other grants that other hospitals have applied for or other vendors have applied for, and we partnered with them. So some of them were a behavioral health workforce grant that Boston Children's Hospital led. Another one was a behavioral health workforce grant led by the North Shore Workforce Board. We worked on a nursing assistant grant led by Catholic Charities. And we are part of a research administrator grant led by an organization called STACK. And most recently, we're part of a patient registration grant led by Boston Children's Hospital. So we're able to train some folks through other people's programs as well. Next slide. So I'm going to take a sip of water. Hold on. The last thing I wanted to talk about is I'm also the chair of the State Workforce Board. And one of the things I love is workforce boards have awesome access to great data that helps you think about how does what's happening in the bigger picture of Massachusetts impact my organization. Next slide. So I'm just going to show you 2 slides from a recent board meeting. If you see the blue line, that is new unemployment claims. And you'll see that new unemployment claims are not increasing as of July this year. So we're not having a lot of people hit unemployment. Next slide. But what is happening is people who are on unemployment are staying on unemployment a little bit longer. And so that's what's happening in this economy right now. And so if we go to the next slide, my point is sometimes it's helpful just to understand the bigger economic picture. And so that's another great way to connect with workforce boards and understand what's happening with your local economy. And the state board meeting is open to anyone. And we always have a labor presentation. So I'm going to stop there for questions.
Joanne, we don't have any questions in the chat at this point.
All right, then we're going to move on to the next part of the agenda. And that is Tom Hooper, I believe.
Great. Thanks so much, Joanne. And thanks as well to Ken and Matt. Really appreciate all those presentations. That was terrific. For the next portion of the agenda, Jenny, Tommy, and I are going to provide an overview of the Commonwealth Corporation, which we'll refer to as ComCorp for short, and one of our critical workforce programs that has a major focus on healthcare, and Joanne actually just touched on it. As Ken, first, just a little background on ComCorp. As Ken and Matt mentioned, ComCorp is a quasi-public agency that falls under the umbrella of the state's Executive Office of Labor and Workforce Development. We enhance training on behalf of the state legislature and the Healy Driscoll administration. Next slide, please. Through our work, we support all sectors of the economy, and particularly those with acute labor shortages like healthcare and manufacturing. Employers are central to our work. In all of our programs, we ensure that employers are critical partners and that the grants that we award address the very specific workforce needs of area employers that are a part of any grant application, any project. Our programs focus on a number of critical populations, such as unemployed and underemployed workers, youth, and young adults with disabilities. Those are just a few examples. At ComCorp, we play several key roles in workforce development, including awarding and administering workforce training grants that build the skills of workers while addressing employer hiring and training needs, as well as providing technical assistance to our grantees. Next slide, please. We have one overarching goal for all of our work here at ComCorp, which is building worker skills to support a strong economy. And we do that by investing in the future workforce, helping develop a pipeline of workers who are job ready, and focusing on training and upskilling the current workforce. Next slide, please. Finally, just a little more background on ComCorp. The programs that we administer have a very broad reach, serving a large number of workers all across the state. Last year, we awarded over $130 million in grants across all of our different programs that collectively served more than 47,000 individuals and supported over 2,000 employers statewide. And again, those are employers from all different sectors with a big focus on healthcare. Our programs serve individuals in regions all across the state, from the Cape to Western Mass, and again, collectively serve all industry sectors like healthcare, construction, and IT. Healthcare is one of those primary sectors that we support, and Jenny and Tommy will discuss that further in a second. We also place a unique focus on underserved individuals, including unemployed individuals and individuals of color. So that's a quick overview of ComCorp, and I'll hand off now to Jenny to tell you about one of our major workforce programs.
Thanks so much, Tom. And next slide, please. The Workforce Competitive Trust Fund, or WCTF, is the Commonwealth's cornerstone for sector-based workforce innovation. This slide shows the full spectrum of WCTF-funded programs that are each designed to meet community and employers at different stages of readiness. Our 2 to 3 year implementation grants of up to $500,000 fund large-scale partnerships that deliver training, leading to credentials and employment. The 6-month $50,000 design grants have given organizations the space to build or refine new models before launching them at scale. And we also invest in 2-year programs focused on ESOL and job coaching, helping to remove barriers for job seekers who need more support. And then finally, our regional hubs are our 3-year investments and are bringing together workforce boards, training providers, and employers to align resources and build regional capacity. Together, all of these programs form a coordinated ecosystem, and we're really proud of our ecosystem that both advances individual opportunity and employer competitiveness across the state. Next slide, please. Over the past 4 years, WCTF has grown significantly in both scale and impact. From 2021 to 2025, we've awarded over $90 million across 125 unique grantees and supported training for more than 6,000 Massachusetts residents. These investments represent more than just financial awards. They represent partnerships, and each grantee has built cross-sector collaboration opportunities that connects employers, educators, and workforce boards to create direct data-driven pathways into high-demand occupations. What's really exciting for us is that these investments have reached communities all across all 7 workforce regions, both urban, suburban, and rural, and is really driving equity, the ability for us to increase equity and access statewide. And as we're looking ahead, we're really focusing on sustaining these outcomes by helping grantees to transition from one-time public funding to blended models that include employer investments, as well as investments and partnerships with philanthropy. Next slide, please. The WCTF has been part of Massachusetts workforce infrastructure since 2006, but the past several years have really represented an unprecedented period of investment. With support from the legislator, the Executive Office of Labor and Workforce Development, and federal ARPA funding, we've been able to expand the fund's reach and diversity in all of the sectors that we serve. And historically, WCTF has focused heavily on healthcare, and that does remain one of our strongest areas of impact. But with these new resources, we've been able to support additional sectors like clean energy, IT, advanced manufacturing, and early childhood educations, which are all industries that are really vital to the Commonwealth's future. These historic investments have helped us not just meet immediate workforce needs during the recovery period, but also really built an infrastructure for us to really contribute to long-term growth and innovation. Next slide. This slide gives a snapshot of current WCTF, our current WCTF grantee portfolio. There's roughly 115 active programs across Massachusetts, and you'll notice that while healthcare continues to represent a significant portion of our work, we've also seen a notable diversification across other sectors. And this diversification matters because it means that our workforce is more resilient, more responsive, and more inclusive. And by investing in multiple sectors, we're not just filling jobs, but we're creating pathways to quality careers that align with both regional and statewide economic priorities. Next slide, please. As we look into the future, the focus for WCTF is sustainability, collaboration, and impact, and we're proud of the progress that we've made. But we also recognize the fiscal reality ahead with less flexible funding available, and our work is now going to start to shift toward helping grantees build partnerships and resource strategies that will allow this momentum to continue. Our core tenets in our WCTF team is to emphasize shared learning by connecting grantees across sectors, and encouraging employer co-investment, and aligning our efforts with other Commonwealth Corporation programs and initiatives. The success of WCTF has always been rooted in our partnerships, and our goal is to carry that spirit forward, ensuring no matter where the funding landscape evolves, we're going to continue to build an inclusive, skilled, and future-ready Massachusetts workforce. And I'm going to turn it over to Tommy. Tommy, you're up.
Thanks, Jenny. Yeah, so we have an upcoming RFP for WCTF that will be re-released, and just want to kind of give you some pictures of how to navigate to find that. The date at the bottom will tell us it's mid to late November. I think that release date might be pushed back to more like early December. So, but what this is displaying here is a way to navigate on our website to access our available funding page. So if you go to comcore.org, in the top right-hand corner, there will be on that white bar at the top on the far right is available funding. And if you click on that, that'll bring you to our available funding page. And that includes a variety of open RFPs at the time that some of them may apply to this group and others may not. But once the Donnelly grant is published there, you'll be able to go to that web page and then click on the WCTF FY26 RFP post, and that'll bring you to that specific page and give you all the information that you need for accessing the RFP, signing up. We can offer Q&A responses in writing, and so you can submit questions and we'll respond in writing and post those, and you can get those sent to your inbox and so forth. So just kind of keep that on your radars over the next handful of weeks here, and hopefully in about a month or so we'll have an RFP released and ready for access. Next slide, please, Nick. Wanted to highlight some recent WCTF awardees that are MHA members. And so Joanne has spoken already about her experiences with BILH, but also want to highlight Boston Children's Hospital was recently awarded a grant and has had a grant in the past, and they're currently working on a project for training patient representatives. Hebrew Senior Life is another recent awardee, and then they've had a grant in the past as well to train certified nurse assistants, and they also integrate some ESOL support into that project. And Mass General Brigham has been running a medical lab science training program, and that's been underway for a little over a year now. So all of these are lead contractors over the past handful of years, and is one way to engage with ComCore and with WCTF. If Nick, you can go to the next slide, please. But also want to highlight, and this kind of reflects the poll in terms of, about 81% of respondents were saying that they have had some engagement with MassHire, with ComCore in the past, but these are the systems that have been engaged with WCTF in various ways, whether that be as an employer partner on a project, as a direct lead contractor, lead grantee, but it really runs the gamut. I think if I kind of did a quick snapshot of your membership list, it was about 75% or so are represented in WCTF world already. So and again, these are committed employer partners who are deciding to leverage these resources to source talent from the training programs that WCTF is supporting. So really appreciate the wide scale partnership, the statewide partnership that's already underway, and hope that it'll continue to grow. Next slide, please. One initiative that Jenny highlighted as one of those kind of sub-programs of the WCTF umbrella is these healthcare and behavioral health hubs. So this grant traces back to late 2020, early 2021, and to the present. But essentially, there are these regional hubs that have been established in each of the 7 regions. You're getting used to seeing that state graphic by now, and it's led by the Workforce Board. So there's a lead Workforce Board in each of the 7 regions, and their responsibility is to expand training programs that respond to employers' demand for healthcare and/or behavioral health occupations. And so this was a statewide investment of about $16 million back in 2024, leveraging WCTF and ARPA resources. And really is having a really wide impact so far in supporting access to training, supporting a number of different pathways, and engaging a number of employer partners and training providers. We're projected right now to serve about 2,300 unemployed, underemployed, and a smaller percentage of incumbent workers between 2024 and the end of 2026, while that funding is available. There are 17 occupational pathways, which I'll cover in the next slide, to give you a sense of what trainings are being supported. These 58 employer partners are those who have just submitted, a memorandum of agreement to commit to being an employer partner. But that doesn't mean that there isn't opportunity to still get engaged. And there are other employers that are involved who didn't sign an MOA but are sourcing talent from these training programs, and so that number is likely higher. And we're leveraging 41 different training providers that can include, community-based organizations and proprietary training providers. I believe 12 community colleges of the 15 are supporting some kind of program. The Chapter 74 Voc Tech schools are also involved. And in some cases, the employers are the training providers themselves. And so how to get involved, these are active grants that are, almost 2/3 of the way through. But now we have over 1,100 people have enrolled in training and over 800 people have completed training. And so all those people in a large case are looking for jobs. Maybe about 50% of those 800 are still looking for jobs. And so talent is out there. And I'll talk to the next slide. But the way to get involved is, to reach out to your regional MassHire Workforce Board or your local career center and inquire about training graduates who are still seeking employment. They're there, they're trained, they're ready. And if or let them know ahead of time, like, hey, are you running trainings in the future? Share job descriptions, share job postings, let them know that you'll be hiring. And then they can, start to funnel candidates your way for the different occupations that you might need. If they could go to the next slide, I'll give an overview of kind of the regional representation. So these are the 17 pathways that that are being trained for. CNA and medical assistant has the highest volume. I think about 60% are CNA and another, or I'm sorry, 60% combined are CNA medical assistant, with CNA being the most popular. But each of the 9 lead grantees are noted at the bottom, and I've used a kind of a superscript to kind of indicate which regions and workforce boards are training for that pathway. So for example, behavioral health associate is in Region 2, which is run by the MassHire Hampton County Workforce Board. Whereas any nurse assisting roles, you'll see there are 6 different regions who are supporting that role. So feel free to reference this list in the table at the bottom to kind of see what kind of training pathways we're supporting. But again, I can't emphasize enough that there are lots of eager candidates ready to work who are trained and now credentialed and looking for employment, and it would really support them to tap into this talent pool that's already ready. If you can go to the next slide, Nick, real quick for me. And this is a list of the different workforce boards that are the lead contractors and who their staff are. And the red highlighted names are the project managers, kind of the primary contacts. And so each of these names are hyperlinked to an email. So if you clicked on one of those links, you'll be able to go directly to an email to send to that person. So if you are looking for talent, if you have open roles, or you just want to get involved in the hub itself and engage in that regional partnership, feel free to send these folks an email and let them know, and they'd be happy to include you and update you on the different training graduates and options coming forward. And I believe that does it for us. I know there might have been a handful of questions in the chat. Just doing a quick check there. There was a question about preceptor and training shortages for entry-level roles, with managers having a harder time accepting new grads out of these programs because they don't have the ability to take on new graduates. This might be a good question for Joanne and or Jason, if I can kind of lead Jason in before he speaks. But do you have any insight on, especially I think on the preceptor side of things?
I think it's hard, one thing that you might want to think about. So I talked about our medical assistant grant, and that funded a program manager and it funded some training, but maybe a Workforce Competitiveness Trust Fund could fund somebody who's a designated preceptor who could help do that hands-on training for new grads, potentially as part of a training program where people get new jobs.
That's a good call. Thanks, Joanne. Jason?
Yeah, I'll just add, and I'll speak to this a little bit in the upcoming slides here, but on our side, we've leaked back on the registered apprenticeships where we've been able to turn around some of the funds that are available to that to help offset some of the time and training by preceptor. So not necessarily, standardized and developed training for them, but ways to reward the preceptors that are there so that they're incentivized to be able to deliver some of that training.
Great. Thank you, Jason. Thanks, Joanne. And there's a question from Heather. Are recipients required to be in state, or can it be that they provide their services in the state of Massachusetts? That's a good question. So to be a partner employer, you must have operations within Massachusetts. Or the WCTF grant primarily serves Mass residents. Or if you're targeting an incumbent worker training population, they just have to be employed in Massachusetts, but they don't have to be a resident of Massachusetts. And the goal is to employ these folks in Massachusetts at the end of the day. So But if you are an organization who, is headquartered outside of Mass, but has operations in Massachusetts, certainly an opportunity to engage exists there. And we'll keep an eye on the questions in the chat going forward, but we'll hand it over to Jason to take us into the next segment.
Thanks, Tommy. So if we could go to the next slide, please. I am fully aware that we are at the end of the lunch hour, that we may be slowing down. I will try to make some connections back. And what I really want to highlight is Bay State Health's journey, both along in terms of all of these different grant funding sources, maybe a couple of examples of the different partnerships and programs that we've offered. However, I want to offer a sort of a lens from an employer partner that has chosen in many instances to partner with other institutions on grants for training programs and describe how that might work. So if we get through the day, I just want to make sure we connect back to how Bay State's connected to WCTF. I'll talk a little bit about one program with digital and lifelong learning that we've worked on, and then really want to highlight the partnerships. Next slide, please. All right, no, we don't have time to go into all of this, but it's not like we have been doing this since yesterday. Our first WCTF grant started way back, I believe it was in 2007 or 2008, and it was to train patient care technicians. Bay State was the lead on that particular grant. And what we learned from that was that it was a very complex process. Great support from Commonwealth Corporation, but there is a lot that goes into being the lead on the grant employee. So we've kept that in mind. 2011, we were successful in having a healthcare transformation grant. That was one that I was privileged to be partner on and one of the program managers for, where we did some training for our providers at the time in terms of advanced practice models. In 2017, and I believe I spoke on this the other day on an MHA webinar, but we really got into looking at our first registered apprenticeship. And so embraced sort of that earn to learn model where we're doing registered training at that same time. And that, snowballed into a number of different programs. We had a Learn to Earn project through WCTF at Holyoke Community College. You'll hear that name come up at a lot of our programs. Trained medical assistants, very similar to the type of program that Joanne was mentioning earlier. Then that digital lifelong learning and the certified pharmacy technicians. And then most recently, and these will be the two programs that I go into a little bit more in depth here, we've partnered with Holyoke Community College and some other partners to train both patient care technicians, medical assistants, and now actually licensed practical nurses through some earn to learn models where we're actually paying the individuals to learn up front, and then working with primarily Holyoke Community College as the lead grantee to deliver the training in some of those instances. So next slide, please. All right, so here, just really quickly, here is how our PCT to LPN program that's running. This is funded through WCTF. So the way that this program started, we started back in, I believe, 2024. It's a 3-phase project. Phase 1, the employee gets some academic preparation courses. They do that on their own time, and they're taking those particular prep courses through Holyoke Community College. Phase 2 is a structured learning prerequisite program through Holyoke Community College's Foundation of Health program. This is where they're going to get their microbiologies, their anatomy and physiology, any of the prerequisite courses that are going to be on that list to get into nursing school. That's where they're going to get in this particular first year. So the way that it works on our side is Holyoke Community College is delivering the content. This is 4-credit training. Bay State is subsidizing their paid learning time. And then as a bonus, right, they're only in class maybe 1 or 2 shifts per week. They're working for us as a patient care technician. Now, we chose for this particular program to draw in from 2 of our different hospitals, Bay State Health Wing and Bay State Health Medical Center. We handpicked some of our top-notch patient care technicians that were looking for that next step. So it is very much an incumbent pathway. But they get hired in full-time into an LPN trainee role. They work for us as PCTs on at least 1 shift per week, and then they begin to go into the program and get their prerequisites. After about a year, they go into phase 3 of the program, and that is where they actually get into nursing school. And just to give some stats, we just got our first cohort into our nursing program, or the LPN training program here at Holyoke Community College. We had 19 in that original cohort. Of the 19 that were in that structured learning program, we got 15 into nursing school. Now, HCCs, I believe their program only trains 20 at one given time. So that 14 or 15 that we got in was nearly that entire cohort. So we were excited about those particular outcomes. We're still tracking at 100% retention of these particular employees. And what will happen is those employees will continue to train for LPNs as LPNs for the next year. They're still working for us as PCTs at least one shift per week. And then at the end of the year of training in LPN school, they'll be able to get their LPN license, and we'll promote them to LPNs working on the inpatient floor. But the big uptick here is it's a combined program between Holyoke Community College, where Holyoke Community College is the grantee, and we are certainly receiving the benefits of the training and reaping the rewards in terms of the retention for these high-performing individuals. Next slide, please. All right, here's another example of how we've structured it. And again, this is another program where we actually weren't the grantee. Holyoke Community College was. And this was to train patient care technicians. It ran, I believe, from 2023 out to 2024. We were doing 3 cohorts per year of about 15 PCTs at any one given time. We would hire the patient care technicians. This was both an internal pathway and an external pathway. We'd hire them off the street with no patient care experience. We'd hire them as a per diem employee. They would go up to Holyoke Community College. Again, there's that partner train, complete their CNA. Once they completed their CNA and perhaps did their clinicals, we used another partner or employer partner that was part of the coalition. Care One was the employer in that particular instance to complete their clinicals. They would go from Holyoke Community College to another community college, our local Springfield Technical Community College, where STIC would grant them a certificate in advanced acute care training as a patient care technician. At that point, we would start to transfer them and structure them into a transition to practice model on the units, where they would go into either full or part-time, depending on what the employee would was looking for. And then just to call out some braided funding here, this is a registered apprenticeship. And so while WCTF was supporting the first part of the training program delivered by STC and HCC, we link back to the Executive Office of Labor and Workforce Development registered apprenticeship funds administered through MassHire Workforce Board as the fiduciary to cross-train on the additional competencies that the patient care technicians receive, both with some additional technical training once they get onto the floor. So you can see it's a fairly complex process, but it's worked. We were able to train 3 cohorts per year. We've had, I would say, 60 to 75% retention. It is a high turnover environment, but we were able to take folks with no experience to patient care technician training in a short amount of time. Next slide, please. So I've already mentioned some of these partners, but as you can hear, we tend to work with the community colleges as sort of our lead grantees and then support the organizations. We're not afraid to partner with other healthcare employers where it makes sense. And sometimes, and in some instances, we've used separate FEIN numbers from based in its own different companies. But in general, we have found that it is easier to have at least one other employer partner that is part of the coalition. We've served an advisory and consulting opportunity, and we've had a lot of input in terms of what the program content was. For when STIC, Holyoke Community College, or Greenfield Community College was also responsible for training CNAs in the last example that I mentioned. And again, these do link back to both the Executive Office of Labor and Workforce Development for registered apprenticeships, and we couldn't do any of this without the Hampden County Workforce Board that we serve on. To make one additional connection for you, that hub that Tommy mentioned in his last presentation. So the PCT training has just had ended in May of this year. And one of the things that we've worked with MassHire is to look at some of the hub slots that they were awarded for the healthcare hub grant in terms of how we might continue to train those. So our plan is to work with them in partnership to train 20 additional patient care technicians through that funding source. So different connection, different group, but you can see that the opportunities and the partnerships about. So that's the partners. Next slide, please. And then here, really briefly, are the number of the registered apprenticeships that we have. We are currently working on a WCTF grant to train our own medical assistants. It's somewhat similar to the program that Joanne mentioned. However, we're able to do it in a condensed time frame. We take them through a training. It's about 16 weeks for didactics, and then they transition into 4 weeks of clinicals at the primary care or specialty practice sites. And then they transition into a year of on-the-job learning. The connection that I'll make here is that's, again, a registered apprenticeship. So we're working with Holyoke Community College on a WCTF grant. We do need to match some of that from other sources. It doesn't cover the entire outcomes. And so we do match that with some of the registered apprenticeship funding on some of the additional learning that they get. And then you can see that we have a number of different registered apprenticeships. Some I've talked about, some are sort of ancillary to the WCTF process, but we've got 8 or 9 that we're running at any one given time. And then some of these come up from time to time. Next slide, please. So I will stop there. Happy to entertain any questions that you've got. And once we're done, we'll hand it back over to the folks of MHA and Concord.
No questions currently.
Great.
Jason, I've got a question, while we're waiting for, some other questions to come into the chat. And if anyone does have questions, please, put those into the chat and we'll get to them. Can you just talk a little bit more about apprenticeships? I know this is one thing that we're really trying to kind of promote and talk more about. A lot of people think apprenticeship and they don't think healthcare, even though a lot of healthcare roles are basically already trained like apprenticeships. They might just not call it that.
Yeah. For sure. And I know the state's been very active in terms of, both the Healy Driscoll administration and expanding industries. And one of those industries, of course, is healthcare. So what we have learned and observed is for us, the registered apprenticeships give us a way to build, very specific credentials and competency-based trainings towards healthcare careers. And then for the employees, it gives them sort of a structured pathway and a credential. And I showed it on that last slide there, but we've done it with medical assistants, pharmacy technicians, healthcare, sterile processing technicians, just to name a few. And it's worked out really over time. What I will say is we do receive supports through the grants between the Executive Office of Labor and Workforce Development to MassHire. And then we also take advantage of the registered tax credits that I believe Tom had mentioned earlier in the program to help support some of the work. So it's a neat way to be able to subsidize the training and at the same time offer folks a paid learning structure that aids with retention. Does that answer your question, Kim?
It does, absolutely. And actually related to that, I know some organizations might, kind of balk or hesitate a little bit at paying people to get trained while they're getting trained. Can you just talk about like the ROI and the long-term investment and benefits that Bay State is seeing in this?
Yeah, it's a great question, and we face all of the financial pressures that all of our members, all of the MHA members are facing right now in the healthcare landscape. So it is a significant investment in terms of Bay State's time. What I will say is, while it's difficult to quantify an exact ROI, we look at business impact measures. So we look at things such as, have we decreased overtime? Are we spending, increasing our retention? And we know that as we are investing and having them train, if you can take away the financial component for them having to work elsewhere or to be able to get that financial income elsewhere while they're training, you're building a very loyal employee because you're investing them. And then B, you sort of clear sort of one of those life hurdles that they have to get through in order to be successful. And so on our end, take that medical assistant training, we see retentions rates as high as 80 or 90% in some instances, where we're able to capture them and then we track them over time. And that means we're not retraining other medical assistants. We're not hiring folks to come in and precept. We're not paying overtime to staff members. We're not contributing to staff burnout. And so while it's really difficult to quantify that ROI, we know the business impact is there, and that's led to us continuing to fund the model.
Right. And Kim, just to add on a little bit about apprenticeship, to Jason's great points, the Division of Apprenticeship Standards, which EOLWD is very involved in, and Ken and Matt touched on this earlier, have dedicated staff to work with employers and partners in developing registered apprenticeship programs. There's also a big focus in DAS on working in sectors like healthcare that have not traditionally been a big focus on registered apprenticeship, on like construction, manufacturing. So there's a real strong interest in DAS staff on working in healthcare, and definitely encourage folks to reach out to them, the Division of Apprenticeship Standards staff, if interested, and we can help make those kind of connections too.
Yeah, Tom, let me pick up on that point. And that really is my hope today, that you will reach out to us and we will connect you directly. And Jason, you probably know many of these folks, Josh Cutler, who heads up DAS, but also his team, Dennis Collins, Laura, and others. We are happy to make those connections. And I really would encourage you to reach out to us, because as Jason has said, I'm going to have to take Jason on the road with us, by the way, because he was amazing, as was Joanne. Let's connect you to these folks. And again, this is an iterative process, but you have the results as demonstrated by Jason and Joanne, to demonstrate that in this sector, I think registered apprenticeships are one very, very important tool that if you're not using, candidly, you should be using. So I'll stop there, but hopefully you'll reach out to all of us and we'll make those connections personally for you.
Wonderful, thank you. And just for attendees, I'm about to put in the chat links to the recordings of our previous 2 webinars that we hosted earlier this year on apprenticeships. In case anyone is interested, those are free and open for anyone to view.
Other questions that folks have on any of the topics we covered? I'll pose one. I think this is probably best for Jason and Joanne. You both touched on different partners you worked with, like community colleges, community-based organizations. Just would love to hear any suggestions you give to folks who maybe don't have some of those established partnerships in place on good steps for starting to build those kind of comprehensive relationships.
I always start with thinking about, like, can we do this ourselves or do we need a partner, right? And particularly with a lot of credentials, you need a partner who is kind of qualified to provide that credential at the end of the day. And then you just, I think partnerships build over time, and you want to see like if somebody's done that work before. I think that's really helpful. And then you need to have really good communication and feedback loops, because nobody gets it right the first time, right? But the more you can kind of adjust together, I think that makes for a better partnership at the end of the day.
I'll add that for me, it's twofold. One, as we're building these programs, we're always sure to ask the operational managers, right? Because at the end of the day, workforce development, HR, we're sort of facilitating these programs in support of our operational leaders that are running key clinical businesses, right? So they know the programs, that they've had really good outcomes and success. And so we take note of who's doing really well in terms of training. And then the other point that I'll make is a lot of, I can't speak, our world's out here in Western Massachusetts, so I can't speak to it all across the Commonwealth. Though I know here in Hampden County, we have a great workforce board that convenes employers. Also, our Economic Development Council, also a great convener, and we make those connections in those particular partnerships, and that leads from one thing to the other. And as you know, I try to illustrate, we do bounce back and forth between different partners in order to kind of spread the wealth in terms of making sure everybody's supported.
Yeah, question for. Oh, I'm sorry, Matt. Go ahead.
Yeah, Jason's point about reaching out to those workforce boards again. They're really great partners to start developing some of that hub around what you want to develop. They're a way into the healthcare hubs. They're a way into all the programming that can be offered, DAS, all of these things. That's a great space to interact with, connecting with those local boards in your different regions. If you have hospitals or patient care facilities in different places, map them out. Those maps that we have in here are really helpful to figure out where to connect, but use that as an entry point as well. But we're also here in the executive office to help you make those connections across different state programs. But I think Jason's point about the local boards is it's extremely important to have a long-term relationship with them to see as things are evolving as well.
I wanted to add that the greater Boston area has the Boston Healthcare Careers Consortium, which is employer-led and meets quarterly. And it's basically healthcare employers and and our partners coming together and just talking about what's happening in the healthcare space. So that's, if you're not connected to that, feel free to reach out to me or anyone, and we'll get you on that mailing list.
Yeah, that is an excellent group. I love those meetings. I sit in on those. Joanne, question for you in the chat. Did you include feedback from your staff before you began your process of, it doesn't say process for what specifically, but getting any of the initiatives up and running?
I think what Jason said it well. Like, we're building a program for the hiring managers in an area, right? So we're working with hiring managers to say, does this sound like a program that's going to work for you at the end of the day? And so we're always collecting feedback from the hiring managers, but also during and after the program, we're collecting feedback from people who are in the program about what worked and what didn't work. So we're not doing that before the process, because before the process, we're working with sort of the operational people and the people who will be hiring these folks. But then after the process and during the process, we are getting feedback from people in the program.
That's great. Thank you. Another question in the chat, I guess this is for anybody. With HR1 and Medicaid changes, we expect that many Medicaid members will need to meet their work requirements. Any special initiatives to address a surge in need to meet these work requirements?
I could kick things off with this one. From Common Corp's perspective, we haven't started developing any new special initiatives to address those specific changes. I think what I would encourage folks to do, though, is actually reaching out to those healthcare and behavioral health hubs that Tommy Heverin referenced, in addition to groups like the consortium Joanne just mentioned, just because there are going to be existing training programs in place that could be a good fit to help folks gain experience and ultimately enter the workforce. And so looking at some existing initiatives, I think is a good starting point.
I would also say, I would think the one-stop careers, like when this becomes a reality, the one-stop career center should be in a pretty good place to help people connect to jobs who need to get a job, who have work requirements.
Yeah, and I would just add that the Healy District Administration is really looking at all of the aspects of this bill and the impacts that it has, and really trying to limit the amount of people that come off of Medicaid due to eligibility requirements, trying to do that through all the systems that we have. So that's kind of a first level that has to go through. And certainly as people start to see the impacts of other things, we want to know about where those are. Are they impacting certain workforce sectors? Are they impacting certain areas differently, so that we can start to be responsive to that? But it's a big impact for sure. And we want to be in touch with you about how that comes about.
Great, thank you. Another question, Jason and Joanne, either or both of you, were there any roadblocks that felt, as you were getting started in this work, were there any roadblocks that felt like insurmountable or just really big that ended up not being as big as you thought? Or any other tips for organizations that are kind of just getting started down this path? Thoughts from either of you?
Well, I'll add, there's ComCorp has a long and great history of really working with their grantees in terms of designing programs. And sometimes those of us that have got past grant history, we get stuck in our ways and thinking of how things need to be structured. And I just really want to give them a call out in terms of the flexibility that they've been able to work with us on. And as we brought our coalitions together and even to the point of offering, different thought alternatives. Sometimes these programs can lead to higher cost per outcomes, which isn't great. And they've been really good for helping us think through how we might structure things to make the numbers work, and ultimately have led to successful programs.
And I'll say, I can't think of a program that hasn't had an obstacle, right? And so I talk to my team all the time. Our job is to okay, here's the obstacle. What's our strategy? You know what I mean? And these are complex programs to put together. We have to partner with a lot of different entities within HR and outside and operationally to make it work. And there's always kind of something that comes up. But so the more you invest in this space, the more you have a team that is good at being okay, well, we're hearing this, and what do we want to do? What's our strategy? What's our reaction? Because there are a lot of obstacles to making things work. This is not easy work. And it takes a lot of skill to make it work. And so the more practiced you are as an organization, the better you get at dealing with some of these obstacles.
Any advice, this is open to anybody, advice for smaller independent community hospitals that might be looking to say, okay, well, BILH has a ton of resources, Bay State's got a good number of resources, but I'm just by myself and I have maybe 2 or 3 people. How to kind of get started if you're one of these smaller community hospitals, independent hospitals that doesn't have a big team or a big system to kind of lean into?
I always say start with one program that you think will be important and where there's a lot of pain, right? Like start where the pain is. There's a pain point you need to address. And really just once you solve for one problem, then you kind of get better at solving for other things. You can't take on, even with, and I don't have a lot of resources, but even in a big organization, we can't even, we don't have the capacity to deal with everything we should be dealing with, right? We're just kind of taking bites out of the apple. And I think that's a good way to start, is to start small. And also I'd say if you're really small, you don't have a lot of internal resources, then maybe there's a nonprofit partner that could take on some of that work for you, and you could partner with them, and you could be a good employer partner where maybe that training partner is doing a lot of the work.
I'll add, most of the WCTF RFPs that I've seen come out always require 2 employer partners, right? And so, you know, somebody big in the area is always looking for that other potential partner to work on. So to piggyback off of what Joanne is saying, find a partner. And if you don't know who's working through that, you know, your MassHire rep could probably connect, because they have a good sense in terms of who's going after the dollars in the region.
Yeah, we would just add, Joanne made a great point earlier about relationships. And look, you have to start somewhere, start small, do a pilot perhaps, but also sort of take a step back and develop a relationship with our career centers and our workforce boards, because they know those partners that both Jason and Joanne are talking about. And again, not to belabor the point, please reach out to us if you don't have relationships. There's that 19% that have not engaged with either ComCore or our career centers, and we want to be your point of connectivity with the boards and the career center. So please let us help. But it all starts with that first outreach, that developing a relationship that Joanne talked about, and those will, as Jason has said, bear fruit beyond your first pilot for sure.
Well, only other piece I'll add in is touching on a point Joanne just made, and when Jason's touched on too. There may be organizations in your community that have experience with the WCTF grant in the past or with a similar grant, and have had that kind of capacity to manage a discretionary grant program like that. And they could be good organizations to work with, because there is some administrative work in working on one of these grants. And so they may have that experience to draw on.
Excellent. Well, thank you all. Any other final thoughts before we close out, or any other final words of wisdom? There's been quite a bit shared already, but any other closing thoughts before we break?
I'll just say first, a big thank you, Kim, to you and your team for this opportunity. A big thank you to all of the speakers today. Ken, Matt, Jenny, Tommy, Joanne, Jason, just really appreciate all the time and expertise that you put into and shared during this webinar. And we really encourage folks to take advantage of the different resources that we've shared today, from connecting with workforce boards and career centers, exploring WCTF. And as Ken and Matt have touched on, we'd be really happy to make connections and help folks link up with individuals that maybe in your community you haven't worked with before. So please don't hesitate to reach out, or if you have follow-up questions, reach out there too. But just a big thank you to everyone, and to all you've attended and asked such great questions. Really appreciate it.
Thanks, Tom. And yes, I definitely want to echo, thank you all for being here today. This is such a great program. I was really excited going into it, and at least for me, it seemed to check all the boxes and everything. So hopefully our attendees feel the same. I just want to say thanks to our speakers and the attendees for joining us today. And if you scan the QR code that is up on your screen, you can see all of our upcoming educational programming. We've got a couple of great in-person events coming up with our Women's Conference and our annual meeting. But look forward to seeing all of you at future events. And if you have any questions in the interim, please reach out. We will be sending out the slides and the recording after this, so you'll all get that. But thank you all, and we'll see you the next time.